Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering anemia and bleeding disorders. So before we even get started, guys, if you haven't done so already, please do not forget to like this video and subscribe to the channel. I also cover nursing content different than what's here on YouTube on my other platforms such as TikTok, Instagram, Facebook. Be sure to check me out on those platforms. I have lots of resources for you on my website, nexusnursinginstitute.com, lots of audio lessons, and I have a podcast. It's on streaming on every major platform. My handle's the same anywhere you go, guys. It's going to be Nexus Nursing. Okay, guys, without any further ado, let's get started. Number one. The nurse is admitting a 24-year-old African-American female client with a diagnosis of rule-out anemia. The client has a history of gastric bypass surgery for obesity 4 years ago. Current assessment findings include height 5'5", weight 75 kilograms, pulse 110, respirations 27, blood pressure 104/66, pale mucous membranes, and dyspnea on exertion. Which type of anemia would the nurse suspect the client has developed? 1, vitamin B12 deficiency, 2, folic acid deficiency, 3, iron deficiency, or 4, sickle cell anemia. And guys, the correct answer is 1, vitamin B12 deficiency. So guys, here they gave us some clues for us to know it's a B12 deficiency and not something else. If you go back to the question, it tells you the patient has a history of gastric bypass surgery, right? So when the patient has a surgery of anything cutting a portion of the stomach, we're going to be concerned about B12. And here's why. Remember that the intrinsic factor, where's that found? In your stomach. Your stomach makes that intrinsic factor, and the intrinsic factor is what makes you absorb or be allowed to absorb vitamin B12. So if you don't have intrinsic factor, you can't absorb vitamin B12. You're going to have what? Vitamin B12 deficiency. So whenever you guys get a test question and in it, it tells you that the patient had gastric bypass surgery, patient had part of their stomach removed. One of the first things that you need to be thinking about is this, because remember, the intrinsic factor that makes you absorb vitamin B12 is produced by the rugae in the stomach, okay? So if part of that is removed, you're going to be absorbing much less of that vitamin B12, and it could cause vitamin B12 deficiency. So that's why number 1 is the correct answer. Now let's look at the wrong answer choices. 2, folic acid deficiency. So guys, when you see folic acid deficiency, we usually see this with patients who's had, alcoholism. When you think of folic acid deficiency, you should think of a person that's drinking all the time, because excessive alcohol intake can cause a folic acid deficiency. Next one, iron deficiency. Okay, with iron deficiency, what happens is the patient can have iron deficiency of number 1, they're just not absorbing iron. They're not getting enough iron in the diet. But another way they can have iron deficiency is from chronic blood loss. Okay, so they're losing a lot of blood, their iron is going to go down. And the last one is sickle cell anemia. Well, there's 2 things that I want to say to you about the sickle cell anemia. Number 1, in the question, let me go back to the question. The last part of it says, which type of anemia would the nurse the client has developed? You're born with sickle cell anemia. You don't develop sickle cell anemia. Look how they try to trick you. If you go back in the question, they tell you that's an African American, right? They were trying to distract you. They were trying to get you to think, okay, well, she's black, and most people who have sickle cell, they're what? African American. It must be sickle cell anemia. But no, the question's asking you develop. You're born with sickle cell anemia. You have it or you don't, okay? And the second clue was they told you the patient had a gastric bypass surgery. Whenever you think of the stomach being cut, part of it taken away, you better be thinking of vitamin B12 deficiency. And the second thing I want to tell you about the sickle cell anemia, remember, when we're looking at these signs and symptoms, remember, if you guys have been watching any of my videos, I tell you this. Pain never killed anyone. When you're thinking about a priority of which patient you're going to run to first, pain is hardly ever the answer, because pain never killed anyone, except in certain situations. Certain situations, pain is so serious, it has to be addressed. You're going to treat that patient as the other patients that fall under physiological integrity that you would be running to first, like the patients who can't breathe, or the patients who has something going on with their circulation or hemodynamic status, right? Who does that fall under? Sickle cell, myocardial infarction, burns. I feel like I'm missing one. Stones. Those 4 types of pains, you're running to that patient. You treat them as a priority, right? And if the patient had sickle cell anemia and they were going through crisis, they would be in extreme pain. So that's something else I want you to think about. If you were confused when you're looking at this question and you saw African American, you're like, okay, maybe the patient has sickle cell. Well, number one, they don't develop it, they're born with it. And number two, I'm looking at the signs and symptoms and I don't see anything about pain. And trust me, if that patient is in a sickle cell crisis, they're going to have extreme pain. So guys, that is why number one is the answer. Okay, next question. The client diagnosed with menorrhagia complains to the nurse of feeling listless and tired all the time. Which scientific rationale would explain why these symptoms occur? 1, the pain associated with menorrhagia does not allow the client to rest. 2, the client's symptoms are unrelated to the diagnosis of menorrhagia. 3, the client probably has been exposed to a virus that causes chronic fatigue. Or 4, menorrhagia has caused the client to have decreased levels of hemoglobin. And guys, the correct answer is 4. Menorrhagia has caused the client to have decreased levels of hemoglobin. So I want you to think about this, guys. First of all, menorrhagia is when a patient has excessive bleeding, okay? Excessive blood loss through their menses. So, what was I going to say about, sorry guys, by the way, it's only 2 o'clock in the morning. So I'm still so tired. So if you see I'm kind of loopy, that's why I'm just exhausted. But what I was going to tell you about number 4, menorrhagia has caused the client to have decreased levels of hemoglobin. Remember, guys, hemoglobin is in the red blood cells. Hemoglobin is what carries oxygen. So if the patient's losing all this blood, what they're losing is the hemoglobin that's carrying the oxygen. They're losing lots of oxygen. They're going to be tired. They're going to be excessively fatigued. Why? Because oxygen is what gives perfusion to the tissues, okay? Every single organ, every single tissue needs oxygen to survive. And that's why number 4 is the correct answer, because the patient's lost so much hemoglobin. Because remember, hemoglobin is carried in the RBC, and that is what carries oxygen. Now, let's look at the wrong answer choices, guys. Number 1, the pain associated with menorrhagia does not allow the client to rest. Menorrhagia doesn't cause pain. So that's wrong, okay? 2, the client's symptoms are unrelated to the diagnosis of menorrhagia. False. The reason the patient is feeling so listless and so fatigued is because of the blood loss. Specifically, the oxygen that's being carried in the hemoglobin that's in the RBC is gone. It's not going to the tissues. That's why the patient's so fatigued. So that's wrong. 3, the client probably has been exposed to a virus that causes chronic fatigue. Again, guys, that's wrong. The reason that patient is so exhausted is because of the blood loss, okay? The nurse writes a diagnosis of altered tissue perfusion for a client diagnosed with anemia. Which intervention should be included in the plan of care? Select all that apply. Okay, guys, how do we treat select all that applies? As true or false. You have to address each of these choices individually by themselves. Are they true by themselves? Okay. As students, when it comes to select all that applies, you kind of want to clump the answer choices together to see if it makes sense. That's where you go wrong. You want to go through each one. If it's true, you keep it. If it's false, you throw it out. So let's go. 1, monitor the client's hemoglobin and hematocrit. Absolutely. Absolutely. Guys, any patient with anemia, you're always going to be checking the H&H, because that H&H is going to give you an idea of how much oxygen carrying capacity that patient has because of what? That hemoglobin. So that's very important. You want to check that. Choice 2, move the client to a room near the nurse's desk. Yes. Why? This is a safety issue, guys. Remember, I told you, through the blood loss, the patient's losing what? Oxygen that all of the organs need, including what? The brain. So whenever a patient is lacking oxygen to the brain, what's one of the first things you see happen? Confusion, disorientation. This is a safety issue. We don't want this patient falling, so we want them close to the nursing station so we can run and get to them if something happens. This is a safety issue. 3, limit the client's dietary intake of green leafy vegetables. Excuse me? Absolutely not. We want the patient to have green leafy vegetables. What is in the green leafy vegetables? Iron. Okay, what does iron do? Iron helps you make that hemoglobin, which carries the oxygen in the blood, in the RBC. So that's false. You want the patient to have green leafy veggies. 4, assess the client for numbness and tingling. Absolutely. Why? We're concerned with neurological involvement, right? Because remember, bring it back to the oxygen. Blood loss, oxygen loss. Okay, and we want to make sure that there's no neurological involvement. That's why we're going to check that, guys. Last, allow for rest period during the day for the client. Absolutely. Clients that have a lot of blood loss, which means they have a lot of oxygen loss, they're going to be exhausted. Everything is going to fatigue them. I want you to think about this, guys. Anything you do, anytime you're moving, guys, you're requiring more oxygen. The more things you do, the more oxygen you require, okay? And this patient's losing all of it, so they're going to be extremely fatigued. Next question. The client diagnosed with iron deficiency anemia is prescribed ferrous gluconate orally. What should the nurse teach the client? 1, take Imodium and anti-diarrheal over the counter for diarrhea. 2, limit exercise for several weeks until a tolerance is achieved. 3, the stools may be very dark and this can mask blood. Or 4, eat only red meats and organ meats for protein. And guys, the correct answer is 3, the stools may be very dark and this can mask blood. So any patient that's taking iron, you have to warn them it's going to make their stools very dark. And because they have anemia, we want to make sure that they're not losing more blood, which means they're losing more what? Oxygen. So we tell them to look at your stools to make sure you're not bleeding. But you have to warn them that it's going to make their stools dark. Now let's go over the wrong answer choices, guys. 1, take Imodium and anti-diarrheal over the counter for diarrhea. What? What is one of the major side effects of iron? Constipation. That's why when you give a patient iron, you have to tell them to drink lots of fluids and to eat lots of fiber because iron is very, very constipating. 2, limit exercise for several weeks until tolerance is achieved. There is no tolerance. What are you talking about? Exercise has nothing to do with tolerance and the iron. Nothing at all. That's just false. 3, well, that's the correct answer. 4, eat only red meats and organs for proteins. What did I tell you guys about all-inclusives? Only, always, never, right? Do not choose an all-inclusive unless you know that you know that you know that's the correct answer. Why would you tell them to eat only red meats and organ meats for protein? No, you want to teach that patient to eat a well-balanced diet, okay? However, you can teach them that organ meats are very high in iron, right? And it can increase their oxygen carrying capacity. So you can teach the patient about, organ meats, wonderful. And you can teach them about sources of protein such as fish, great. But don't tell them to eat only red meats and organ meats for protein. Be very careful with those all-inclusives, guys. And if you have if you have 2 choices and one of them is an all-inclusive and you just don't know what the answer is, choose the other one. Don't choose the one with an all-inclusive. The only time I want you to choose that is if you're sure beyond a shadow of a doubt that is the correct answer. And by the way, guys, when you're studying, when you're reading through your textbook and you see those all-inclusives, only, always, never, none, avoid, highlight it, put a star next to it. That means that is something very important for you to know, okay? The nurse and an unlicensed assistant personnel are caring for clients on a medical unit. Which task should the nurse delegate to the UAP? 1, check the bowel movements of a client with melanoma. 2, take the vital signs of a client who received blood the day before. 3, evaluate the dietary intake of a client who has been non-compliant with eating. Or 4, shave the client diagnosed with severe hemolytic anemia. And guys, the correct answer is 2. Take the vital signs of a client who received blood the day before. So we're talking about a UAP, an unlicensed assistive personnel. This is not a nurse. They do not have a license, okay? So let's go through the wrong answer choices and I'll talk to you about the right answer choice. 1, check the bowel movements of a client diagnosed with melena. So melena is when the patient has a stool in the blood, right? Why are we going to tell them to check the bowel movements of that patient? Isn't that an assessment? Can an unlicensed person do an assessment? No, that's the nurse's job. So we're not going to have them do that. And there's something going on with that patient. Absolutely not. 3, evaluate the dietary intake of patient who's non-compliant with eating. Well, evaluate, what's another word for evaluate? Assess. Can an unlicensed personnel assess? No. 4, shave the client diagnosed with severe hemolytic anemia. Okay, so this patient has severe hemolytic anemia. So what does that mean? That means they're at risk for bleeding, okay? Severe hemolytic anemia. This patient most likely has what? Pantocytopenia, right? Why would we have the unlicensed assistive personnel shave that patient? That patient can start to what? Hemorrhage, bleed. Absolutely not. What you can give the patient is number 2. All they're doing is taking a vital sign. That's all they're doing. And UAPs are allowed to what? They're allowed to record and report. So all they're doing is recording the vital signs and reporting it to the nurse. Let's talk about other things that UAPs can do. They're allowed to record and report like vital signs, eye and nose. They're allowed to do that. Matter of fact, they're even allowed to do blood checks, glucometer readings, because all they're doing is checking the glucose and reporting it. That's it. They're not doing any assessment. So they're allowed to do that. They're allowed to do transportation. What do I mean by transportation? If the patient's stable and they need to be transported from one floor to another, they're allowed to put that patient in a wheelchair and transport them. If the patient's stable, right? They're allowed to transfer medication. So you can send the UAP up to the pharmacy to come bring down the medication, because all they're doing is picking it up and bringing it to the nurse. They're allowed to transfer equipment. If you need some type of equipment, you can send them to get the equipment. That doesn't require any assessment or evaluation. They're just getting the equipment, right? So they're allowed to do ADLs, bathe the patient, comb the patient's hair, brush their teeth. There are lots of things that the UAP can do, but assessment, absolutely not. Evaluation, absolutely not. Anything that requires critical thinking. And I'm not saying this, guys, to be offensive to the UAPs. I'm just saying this so you can understand for testing purposes, okay? If something requires critical thinking, it's going to be the licensed nurse. All right, moving on. The client's being admitted with folic acid deficiency, anemia. Which would be the most appropriate referral? 1, Alcoholics Anonymous. 2, Leukemia Society of America. 3, a hematologist. Or 4, a social worker. And guys, the correct answer is 1, Alcohol Anonymous. What did I tell you about folic acid deficiency? The minute you see folic acid deficiency, I want your mind automatically to go to alcoholism. Okay? Why? Iron deficient. I keep saying iron, guys. I'm sorry. Folic acid deficiency. We see this mostly in patients who are alcoholics. The nurse writes a client problem of activity intolerance for a client diagnosed with anemia. Which intervention should the nurse implement? 1, pace activities according to tolerance. 2, provide supplements high in iron and vitamins. 3, administer packed RBCs. Or 4, monitor the vital signs every 4 hours. And guys, the correct answer is 1, pace activities according to tolerance. That's the only answer that has something to do with activity intolerance. Activity intolerance is the problem. So number 1, we're going to help that patient pace their activities, right? So they don't get out of breath, so they don't get so fatigued that they feel like they're about to pass out. Now let's look at our other answer choices. 2, provide vitamins high in iron and vitamins. That's for iron deficiency, guys. 3, administer packed RBCs. Again, That's for iron deficiency. Our problem is what? Activity intolerance. 4, monitor the vital signs every 4 hours. How is that going to help with activity intolerance? When you see the diagnosis, when they give you a client problem and you're looking at your answer choices, because I see you guys do that as students, when you're looking at your answer choices, you're so tempted to choose the answer choice of the diagnosis. So for example, they could tell you that the patient has iron deficiency anemia and the problem is activity intolerance. And when you're looking at your choices, you forget that your problem is activity intolerance and you're thinking about the iron deficiency anemia. Okay? When you see questions like that, make sure your answer matches to the problem that is presented before you. The charge nurse in the ICU is making client assessments. Which client should the charge nurse assign to the graduate nurse who has just finished the 3-month orientation? 1, the client with abdominal peritoneal resection who had a colonoscopy. 2, the client diagnosed with pneumonia who has acute respiratory distress syndrome. 3, the client with a head injury developing DIC. Or 4, the client admitted with gunshot wound who has an H&H of 7 and 22. And guys, the correct answer is 1, the client with an abdominal peritoneal resection who has a colonoscopy. Whenever you have a test question about a brand new nurse or an experienced nurse, but they're floating to your floor. So even though they're experienced, they're new to your floor, or an LPN. Okay? In these 3 situations, new graduate RN, experienced RN, but unexperienced to your floor, or LPN, you're always going to give them the most stable patient. Every single time, guys. Okay? And when we look on this list, who's the most stable patient out of everyone? Number 1. This is a patient that, they had an abdominal peritoneal resection and they have a colonoscopy. Okay? That's what happened. But in that answer choice, they're not telling us anything that's actively going on with them right now, like the others. Let's look at the others. 2, the client diagnosed with pneumonia. Okay. Who has respiratory, before I even say respiratory, look at that word before respiratory, acute. So this is happening right now, acute respiratory distress syndrome. Is that a stable patient? Absolutely not. Look at choice number 3, the client with the head injury. Okay, developing, that means it's happening right now, developing DIC. Is that the most stable patient? Absolutely not. That patient's not stable. Choice number 4, the client admitted with a gunshot. Okay, who has H&H of 7 and 22. Is that a stable patient? Absolutely not. You know that patient's going to be getting blood, right? So the most stable patient is choice number 1, and that's why you're going to give that to the brand new nurse. Which client would be most at risk for developing DIC? 1, a 35-year-old pregnant client with placenta previa. 2, a 42-year-old client with pulmonary embolus. 4, a 60-year-old client receiving hemodialysis 3 days a week. Or 4, a 78-year-old client diagnosed with septicemia. Please excuse my drinking coffee, guys, but I need to stay awake. I know you don't like it, but I'm sorry. Okay, guys, the correct answer is for a 78-year-old client diagnosed with septicemia. Guys, sepsis is the most common cause of DIC. Remember DIC, that's when the patient's clotting, then bleeding. They're clotting, then bleeding. They're clotting, then bleeding. It's a circus, okay? It's a horrible continuation, clotting, bleeding, okay? Sepsis is the most common cause of DIC. Now, let's look at the other choices. Placenta previa, pulmonary embolus, hemodialysis. DIC is not a complication of these, okay? But sepsis is, and that's why number 4 is the correct answer. The client admitted with full thickness burns may be developing DIC. Which signs and symptoms would support the diagnosis of DIC? 1, oozing blood from the IV catheter site. 2, sudden onset chest pain and frothy sputum. 3, foul smelling concentrated urine. Or 4, a red and inflamed central line catheter. And the correct answer, guys, is 1, oozing blood from the catheter site. Why? Because they're in the bleeding stage, okay? Next question. Which laboratory result would the nurse expect in the client diagnosed with DIC? 1, a decreased PT, 2, a low fibrinogen level, 3, an increased platelet count, or 4, an increased WBC. And guys, the correct answer is 2, a low fibrinogen level. That fibrinogen level predicts for us, where was I? I'm sorry, guys, 1 second. That fibrinogen level predicts for us how much, when that patient's going to be bleeding, okay? So as the fibrinogen level goes down, we're going to see that bleeding go up. So it's an indicator. It lets you know, as you're looking at that fibrinogen level, as it starts to drop, that lets you know, guess what? That bleeding is going to increase. As we see that fibrinogen level higher, we know that bleeding is going to what? Decrease. So we look at that fibrinogen level. It really helps us. And by the way, low fibrinogen level, that's how we know that, again, guys, that bleeding is going to go up. Let's look at the wrong answer choices. 1, a decreased PT time. Prothrombin time, PT, PTT, they're all going to be what, guys? Prolonged. They're going to be extended in DIC. So that's wrong because this says decrease, and that's false. It's going to be increased. Your prothrombin, your PTT, all those levels are going to be increased. Why? Because it's taking longer for the patient to clot. They're bleeding all over the place, right? 3, an increased platelet count. No, we're going to see what? Decreased platelets count, okay? Why are we seeing a decreased platelet count? Remember, I told you, they're bleeding, then clotting. They're bleeding, then clotting. They're bleeding, then clotting. So here's what happens. Your body is meant to try to survive no matter what. So your body starts freaking out. Your body's like, okay, what's going on? We're bleeding. So all of the platelets are being used to try to what? Clot to stop the bleeding. And that's why you see that platelet count go down. Okay, your body's trying to save you. All of those platelets are being used up trying to stop that bleeding. And so that's why you see that platelet count go down. 4, an increased WBC. No, you see increased WBC in infection. So that is why number 2 is the correct answer. All right, guys. Next question. An unlicensed assistive personnel asked the primary nurse, how does someone get hemophilia A? Which statement would be the primary nurse's best response? 1, it's an inherited X-linked recessive disorder. 2, there's a deficiency of the clotting factor 8. 3, the person is born with hemophilia. Or 4, the mother carries a gene and gives it to the son. And guys, I hope you all chose the answer 4. The mother carries the gene and gives it to the son. The UAP asked how. Go back to the question, guys. It says, how does someone get the hemophilia A? Let's look at the other choices. 1, it's inherited X-linked recessive disorder. That's true. This whole statement is absolutely true. But is it true for our question? Because what our UAP wants to know is how. And guys, this is how the test writers will trick you. They will give you an answer choice that's absolutely true, but it doesn't answer your question. Don't be tricked by this, guys. Number 1 is true, but it's not answering our question of how. So that's why that's wrong. 2, there's a deficiency in the clotting factor 8. This is absolutely true for hemophilia A. Absolutely. But it doesn't answer our question of how the patient gets it. Number 3, the person is born with hemophilia. That's true. That is absolutely true. But it doesn't answer the question of how they get it. But number 4 answers the question. How did they get it? The mother carried the gene and gave it to the son. Okay? Number 4 is the correct answer because it answers how the patient gets it. So guys, don't be fooled by this. Remember, always, when you see your answer choice and it's beautiful and you know for a fact that your answer choice is true, go back to the question to make sure that it's answering the question. Which sign or symptom should the nurse expect to assess in the client diagnosed with hemophilia A? Epistaxis, petechiae, subcutaneous emphysema, or intermittent claudication? And guys, the correct answer is epistaxis, nosebleed. Remember, the patient with hemophilia A, it's they bleed easily because they don't have the clotting factors, right? Or they don't have enough of the clotting factors, so they bleed very easily. Petechiae, guys, this is like tiny red spots under the skin. We really don't see this with the hemophilia A. The patients who had the hemophilia, we see what? The bruising, okay? Not really the petechiae, so that's wrong. Subcutaneous emphysema, that's air that we see like in the lungs, so that's false. 4, intermittent claudication. That's pain that the patient gets when they're not getting enough oxygen to the muscles of the legs, of the lower extremities. Okay, so when that patient can have circulation issues, and so they may have intermittent claudication because the more that they walk, right, the more oxygen those tissues and the muscles would require. And so if the patient doesn't get it, they can have pain in their lower extremities. That's intermittent claudication. But the question's asking us about the signs and symptoms of hemophilia. So your signs and symptoms of that patient with hemophilia A is going to be bleeding, such as epistaxis. And remember, guys, those patients with hepatitis A, not only, can they have epistaxis. When I say bleeding anywhere, guys, they are known to have bleeding within the joints, bleeding gums, right? Just bleeding, even hematuria. Next question. Which situation might cause a nurse to think that the client has Von Willebrand's disease? 1, the client has unexpected episodes of hematemesis. 2, the client has microscopic blood in the urine. 3, the client has prolonged bleeding following surgery. Or 4, the female client developed abruptio placentae. And guys, the correct answer is 3. The client has prolonged bleeding following surgery. So Von Willebrand's disease, guys, that's a type of hemophilia. And so that's why number 3 is the correct answer. So this patient just had surgery, but they're still bleeding, okay? So we may suspect that. Let's look at the other answer choices. Unexplained episodes of hematemesis. Client has microscopic blood in the urine. A female client developed abruptio placentae. None of these are indications of Von Willebrand's disease, but an indication, a sign and symptom, something that should make us suspicious of Von Willebrand's disease is 3, that patient who had surgery, however, they're having prolonged bleeding. That means bleeding that surpasses what we expect to see for that type of condition. The client with hemophilia A is experiencing hemathrosis. Which intervention should the nurse recommend to the client? 1, alternate aspirin and acetaminophen to help with the pain. 2, apply cold packs for 24 to 48 hours to the affected area. 3, perform active range of motion exercise to the extremity. Or 4, put the affected extremity in a dependent position. And the correct answer is 1, apply cold packs for 24 to 48 hours after, to the affected extremity. So guys, hemathrosis, that's when the patient has bleeding in the joints. Remember I told you those patients with hemophilia, they're known to have bleeding in the joints. So this is the correct answer. Why are we applying ice? Cold causes constriction, right? We want to decrease that swelling to the area, so that's why we're going to do it. Now let's look at our other choices. Alternate aspirin and acetaminophen. What do we know about aspirin? It can cause bleeding. This patient's already bleeding. Do we want to make them bleed more? Absolutely not. 3, perform active range of motion. No. When that patient is experiencing bleeding in that joint, we want to rest that joint. We're putting ice on that joint for a day or 2, and we're going to make sure that they rest it. And then 4, put the affected extremity in a dependent position. When they say dependent position, they're meaning like below the level of the heart, like to let, gravity help. Absolutely not. You want to elevate. Let me back up, guys, because I said something that's wrong. When a question says to put something in a dependent position, that means below the level of the heart, okay? But when the patient has that bleeding, you want to put it above the level of the heart. And the reason you're putting it above the level of the heart is because you want gravity to help. You want gravity to help to do what? To decrease that swelling. And so that's why, guys, number 2 is the correct answer. Excuse me for just one moment. Okay, guys, we are down to our last question. The nurse is caring for the following clients. Which clients should the nurse assess first? 1, the client whose PTT is 38 seconds. 2, the client whose hemoglobin is 14 and the hematocrit is 45%. 3, the client whose platelet count is 75,000. Or 4, the client whose RBCs is 4.8. And guys, the correct answer is 3. The client whose platelet count is 75,000. Okay, so let's talk about this. By the way, the platelet count should, when the patient count is, when the platelet count is less than 100,000, you're going to see bleeding. Okay, and this patient count is 75,000. When that platelet count is less than 100,000, you're going to see what? What is it? What's the diagnosis? What's that called? Thrombocytopenia. Penia, little bit, right? Thrombus, cyto, blood cells, penia, a little bit. So a little bit of what? The clotting cells. What are your clotting cells? Your platelets, right? So that's the correct answer. Guys, choices number 1, 2, and 4, all of these are within normal limits. There's nothing wrong with them. There's nothing going on. None of these are abnormal. But number 3, that's abnormal. You're going to be concerned about that patient bleeding out. Okay? Guys, I hope this video was helpful to you. And if this is your first time watching me, I promise, I guarantee you, this is not the normal me. Like, please go watch some other videos and you'll see this isn't the normal me. I'm just very exhausted and I apologize. But I'm telling you, if I didn't do this video right now, it would not get done for maybe another 2 weeks. So if you're new, sorry, go watch my other videos, I promise. Those of you who have been following me, guys, I love you so much. You have no idea, because I make these videos and, you know, sometimes I tell you what's going on with me and I see you in the comments and you guys are so supportive and encouraging. And I love when you put in the comments, you let me know what test you just took and my video helped me, or you let me know, you know, a certain question that I talked about in the video and you saw in your exam. Thank you so much, guys. Give me feedback, because when I make these videos, I love to give feedback to you of, you know, certain content that a lot of students are seeing, especially my students who go and take the NCLEX and, you know, they come back and they put in the comments and they tell me they passed and they say, Professor D, I saw this or I saw that. Oh my gosh, you talked about this and I saw it. That helps me to give it back to you guys when you guys are watching these videos, because I want you to go take that NCLEX and pass it on your first time. So guys, thank you for spending this time watching my video. If there's anything you'd like to see me cover that I haven't already, or maybe I have, but you want me to go deeper, cover more questions, cover more content, please leave me a comment. Let me know. I'm going to make sure I get that video for you. Don't forget about checking out my other videos and content on social media, such as TikTok, Instagram, Facebook. Don't forget to check out my website, nexusnursinginstitute.com. If you're struggling and you need to hear my voice in your head, go get my audio lessons, guys. I promise they will help you. And lastly, guys, please do not forget to like and subscribe to this video. Please share my video, share my content with your nursing instructor, with your classmates, anyone that you know may benefit from these videos. Please share them on your social media platform, guys. Thank you so much, and you'll be seeing me on my next video.